The World Health Organization estimates that there's 1.5 billion people globally with hearing loss, and due to the rising population, that number will be 2.5 billion by the year 2030. There are different types of hearing losses. Some hearing losses are temporary hearing loss due to maybe wax impaction or an infection of the middle ear. Other hearing losses are permanent due to nerve damage. Hearing loss can be the result of the natural aging process, could be genetics. Noise exposure is another big one that we see. There are also certain medications that can cause hearing loss. The first part of the hearing test is we just take a case history, sit down and talk about what's been going on, if you're noticing any hearing loss, or if you have specific complaints of pain or pressure or ringing in the ears. The next thing we'll do is just a visual exam, which we call otoscopy. So we'll take a look in your ears, check the outer ear. After that, we do a pressure test, which tells us how well the eardrum is vibrating back and forth. Next, we put little earplugs in your ears, and it's very easy. I always say it's much easier than going to the dentist. It's not painful. It's just listening for beeps. We're looking for the softest sounds that you can hear at each different frequency that we test. And then we also do some speech testing to understand how well the brain is processing speech in quiet at a nice, comfortable level. And the other part of the test that we do is called bone conduction, and that just helps us determine what type of hearing loss you have. So getting back to the, is this a temporary hearing loss or is this permanent nerve damage? If the hearing loss is permanent nerve damage and there's no medical intervention that would help with the hearing loss, then we would want to talk about hearing aids to compensate for the permanent hearing loss that we know we can't cure. Hearing aids are different. It's not like glasses where you put them on immediately and things are perfect. Hearing aids take some time to get used to. If you've had hearing loss for, let's say, 5 years or even 2 or 3 years, and all of a sudden we're giving your brain back some of the information that it's missing, it can take a while for the brain to get used to that sound again. Sometimes the sounds that we're giving the brain back are annoying sounds. They're screechy or very sharp or dull because it's usually a high frequency hearing loss. So it can take some time for the brain to adjust to hearing aids. I would say the biggest and most important is just an improvement in the quality of life for not only the patient, but for their family and friends. We're getting that person back in conversations so they're not missing out. You know, there's also a lot of research that's just come out in the last couple of years that talks about how important treating your hearing loss is to reduce the effects of cognitive decline and Alzheimer's and dementia that could be related to hearing loss.